Hello, my name is Raymond Corey Smith. I'm from Leary, Georgia, and I'm here to talk to you about depression. It's a dip in the road sometimes. A dip is slight, doesn't matter, hinder a driver. Other times it's more serious disturbance like a pothole. It may even throw off the alignment of the car. A major depression, however, is like a sinkhole. Depression is a serious common illness that most people have a little or no true knowledge of. Through my current research, personal experience with depressed individuals, I have gained an acute knowledge of depression. Today I will discuss the depression and is the signs and the symptoms. And so, first things first, what is depression? Is depression really cause for so much attention? According to the National Institute of Mental Health website, last updated July 2011, depression is more than just a sad feeling. It is a common but serious illness that affects 26% of Americans over the age of 18. There are several forms of depressions and disorders, such as major depressive disorder, dysthymic disorder, minor depression, psychiatric disorder, postpartum disorder, several affective disorders, and bipolar disorder. Some of these illnesses may last 2 weeks or several years. They may vary severe or just minor causes that last 2 weeks or several years. Depression can also cause by a variety of different things. Postpartum depression is what many women experience after giving birth when hormonal and physical changes and new responsibilities of carrying a newborn can overwhelm. It is estimated 10 to 15% of women will develop postpartum depression after giving birth. Seasonal affective disorder is characterized by depression during the winter months when there is less natural sunlight. Now we have the general idea of what depression is. What are some ways that they can spot early signs of depression? According to Greco and Edwards, the central part of the brain is what controls our raw emotions, while the outer part of the brain controls our body functions. The exchange of signals between the two parts of the brain is what gives us our feeling and thoughts of depression and behavior. Depression occurs when signals are inadequately exchanged, and the number one cause of inadequate exchange is stress. This is why you look at more than just a person's mood to determine depression. You also look at the energy and concentration they have, and pain and perspective, of sleep patterns and of appetite, all of which can be affected by stress. Depressed people feel empty if they have nothing to hold them up. They sleep more and incapable of emotional exertion. A little matters to them, even whether they live or die. Some forms of depression also include irritability, racing thoughts, talkativeness, and feelings of guilt. So, how can you treat depression? According to the article in Yoga Journal, Barneson states that it all depends on the type and severity of the depression of the patient. According to her article, Dr. Heath Tracy states that fluoxetine or Prozac is the most common prescribed drug to depressed patients. Before some take antidepressants, he or she talked to their doctor about the risks and benefits of treating the condition with the antidepressant. They should also be very patient with the antidepressant because it may take 2 to 3 weeks or longer before the patient feels the full benefit of it. Now that I have discussed all the topics I have planned for today, I will draw my speech to an end. In closing, I hope you all have gained a bit more knowledge about depression from my speech. I defined depression as a common but serious illness, explained that depression affects people's moods, energy, concentration, pain, perspective, sleep patterns, and appetite, and described the most common treatment options available. So, if you don't take anything else from this speech, I hope you come to realize that depression is nothing but ashamed of the fastest way to overcome it is to admit that you have it and seek help for your physician. Thank y'all, and I hope y'all have a good night.